in our fast-paced world, this hyper-connected world, we're kind of navigating this strange, almost unsettling paradox. Despite having like endless digital connections, notifications, feeds, constant information, so many of us are feeling, well, lonelier. And mental health challenges seem to be on the rise. It really feels like we're always searching for that genuine connection,
Yeah.
for real support, for someone or something that just listens without judgment. And right into this very human, very vulnerable space, a new player has emerged, and it's evolving fast, making some pretty bold promises. Artificial intelligence. Yeah, AI is stepping in, offering like round-the-clock companionship, empathy, understanding. It sounds futuristic, but for a lot of people, it feels incredibly compelling, like right now. So today, we're embarking on a really crucial deep dive. We're tackling a question that honestly touches all of us, often in really personal ways. To what extent can you actually rely on artificial intelligence as a trustworthy companion, especially, during tough times, during mental health crises? We're going to be unpacking this meticulously, looking at the exciting promises, which are frankly pretty amazing, but also the sobering realities, the downsides. And most importantly, how can we approach AI smartly and safely in this incredibly sensitive area? Our main guide for this is a really insightful article. To what extent can one rely on artificial intelligence as a trustworthy companion for humans, especially during difficult times and mental health crises, by Hassan Mohammed Alizadeh Sultani, plus some other great material you've shared.
Yeah, and what's really striking here is this isn't just about the tech, is it? I mean, the technology is fascinating, obviously. But this conversation, it digs into something way more fundamental. It's really about what it means to be human, to feel vulnerable, to need support, and crucially, how we build trust, especially now in this digital, sometimes isolating world. So our mission really in this deep dive is to pull out the most important bits of knowledge from these sources. We want to help you understand the capabilities, which are impressive, no doubt, but also the critical limitations, the things AI just can't do, and of course, the ethical side of things. The whole point is to empower you, the listener, to make really informed, thoughtful choices about whether and how these tools fit into your life, to your own well-being journey.
That's a really powerful way to put it. And yeah, this deep dive is definitely for anyone trying to figure out modern well-being, for anyone curious about, where technology and mental health meet, and really for anyone who just wants to be properly informed about the potential but also the pitfalls of AI when we're feeling vulnerable. Okay, so let's kick things off by exploring the appeal, right? The allure. What is it that AI companions are actually promising? Why are they suddenly so popular? Well, one of the biggest advantages, and the source article makes this really clear, is just it always there. It's always on. That immediate, unwavering support, supposedly whenever a human just isn't available. The article puts it quite powerfully.
Yeah.
In the middle of the night, when feelings of anxiety or loneliness peak and access to a therapist or friend is not possible, these tools can be a listening ear. And just picture that, right? That moment. It's 3 a.m., everything's quiet. You feel that surge of anxiety or just crushing loneliness. You grab your phone, but, your friends are asleep. Your therapist's office, closed till morning. The idea, just the sheer idea that something is instantly available, gives you a response, some kind of interaction, that's incredibly compelling. It really is. It taps into something really fundamental, doesn't it? That need for connection in those dark moments. It's not just about convenience, I think. It's about bridging that terrifying gap when your usual human support network just isn't there. It's like maybe a virtual safety net, at least when you feel completely adrift.
Oh, absolutely. And the practical implications of that immediacy, that 24/7 availability, they're pretty profound, especially for, let's say, urgent, but maybe not full-blown crisis emotional support. Think about it in terms of like democratizing initial mental health support. For people in remote areas, maybe rural areas, where getting to a therapist is difficult or impossible, these tools could be a lifeline. Or even in cities, where waiting lists for therapists can be months long. An AI companion offers an immediate entry point. Something. So this constant immediate access can act as a really crucial first line of contact, and importantly, a non-judgmental one, a kind of digital sounding board that's always ready. Now, obviously, you can't replace a human therapist, shouldn't replace one, but its value in just preventing that feeling of total isolation or providing a temporary anchor when you're feeling overwhelmed. That shouldn't be underestimated. It's almost like a form of psychological first aid, even if it's just, conversational algorithm driven. It fills those gaps, those moments of acute need until maybe human help becomes available.
Yeah. And that point about non-judgmental contact, that's huge. It leads perfectly into the next big promise, doesn't it? This idea of a judgment-free zone and maybe even reducing stigma. We all know, I think, that lots of people really hesitate to share their deepest feelings because they're scared of being judged. by friends, family, even, the thought of opening up to a therapist for the first time. And our source text says it directly. Interacting with an AI can remove this barrier and provide a safe space for expressing thoughts and feelings. I mean, just imagine how freeing that must feel to be able to say anything, absolutely anything, your darkest thoughts, your biggest anxieties, without that little voice in your head going, what will they think, or are they judging me? That self-censorship, it's such a massive barrier for so many people who need help but are just, paralyzed by fear of what others might think. So the perceived anonymity, the neutrality of an AI, it could unlock things, couldn't it? Conversations, maybe self-discoveries that just wouldn't happen otherwise, not with another person, like a perceived sanctuary for the unspeakable.
That's a really vital observation. And what's fascinating from the psychological perspective is the relief that perceived neutrality offers. Think about stigma, right? Its impact on people actually seeking care. It forces silence, internalization, wearing masks. So the AI's promise of zero judgment, that can be incredibly powerful in just encouraging self-expression. It's almost like talking to a digital diary that doesn't just store the words, but kind of validates them, prompts you, reflects things back, all without any risk of social blowback or personal bias. And that's a stark contrast to human interactions, which, let's be honest, always have complexities, even subconscious biases, even with the best intentions. So by kind of bypassing that human filter, AI offers this direct channel for thoughts and feelings that might otherwise stay buried. It allows people to explore their inner world with a perceived safety net.
A perceived safety net. Right. And that leads us to another major promise, one that's very practical: cost and accessibility. For so many people, the biggest barrier isn't just stigma, it's the money. Therapy is expensive. Our source article highlights this really clearly. It says, compared to the high costs of psychotherapy sessions, many of these applications are available for free or at a very low cost. And that, it says, makes access to initial psychological support possible for a wide segment of society. And that's huge. It really opens the door for a vast number of people who just flat out cannot afford traditional therapy. Hundreds of dollars an hour sometimes. It's just not feasible. So maybe it's not the full solution for really complex problems, but getting some kind of initial help, some guidance, maybe just a sense of connection, that's got to be better than nothing, right? Mm-hmm. It starts to address a fundamental unfairness in access to care.
Exactly. And if you zoom out and look at the societal impact, making some form of mental health support more widely available, even if it's just initial guidance, a listening ear, maybe some basic coping strategies that tackles a massive global challenge. All over the world, mental health resources are stretched incredibly thin, often non-existent in many places, and the cost barrier, it's huge for most people. So this cost effectiveness, it really acts as a crucial bridge for countless individuals who might otherwise get zero support because they just can't afford it. It lowers the barrier to entry significantly, lets people explore their feelings, maybe get some initial insights, learn a few basic coping skills without that huge financial weight that often comes with human therapy. This isn't just about being cheap. It's about promoting more equity and access to emotional well-being, making sure that a basic level of support isn't just for the wealthy. It casts a much wider net, at least for that preliminary stage.
Right, a wider net. But it's not just about, a friendly chat or a sympathetic ear. And this is where, for me, it gets really interesting. Some of these AI platforms, the more advanced ones, they're actually built around proven therapeutic methods. The text specifically mentions platforms like Wobot, saying they're designed based on proven therapeutic approaches like cognitive behavioral therapy, CBT. And it says these tools can help users identify negative thought patterns and learn practical strategies to cope with stress, anxiety, and depression. So hang on, this is way beyond just a digital diary then. We're talking about actual structured skill building based on established evidence-backed therapy. That's quite a leap. Can you unpack that a bit? Like, how does that actually work? How does an AI take something like CBT and turn it into, an interactive thing?
Yeah, that's a great question because this capability really does push AI beyond just conversation. So for anyone maybe not familiar, cognitive behavioral therapy, CBT, it's a very well-established, very effective therapy. It focuses on helping people spot and change unhelpful thinking patterns and behaviors. The basic idea is that our thoughts, feelings, and actions are all linked, right? Change one and you can influence the others. What's really quite clever is how core CBT principles, things like identifying cognitive distortions, those irrational thought patterns like black and white thinking or catastrophizing or practicing things like mindfulness or getting more active, how these can be effectively built into interactive AI modules. Right. Think of it like this. An AI using CBT doesn't just passively listen. It might prompt you, say, to log your thoughts and feelings, like a digital thought journal. Then, if you express a negative thought repeatedly, the AI could use something called Socratic questioning, which is a key part of CBT, asking things like, okay, what's the evidence for that thought? Or is there another way to look at this? It can guide you through exercises to challenge those thoughts, maybe suggest small behavioral experiments, or even lead guided meditations. These platforms can also give you homework, track your mood over time, provide tailored feedback, a lot like a human therapist might structure things. Now, obviously, they lack that human touch, that intuition, but the systematic delivery of these evidence-based techniques via AI, it has shown some effectiveness, particularly for mild to moderate issues. It's a way to sort of scale up access to therapeutic knowledge and practical skills, making abstract ideas more concrete and actionable, which is potentially a huge benefit for a lot of people.
Okay, so we've explored the appeal, right? The really compelling promises. 204/7 access, no judgment, cost effectiveness, even delivering strategies like CBT. It sounds, well, almost too good to be true in some ways, doesn't it?
Often things that sound that way.
Exactly. And maybe in some really critical ways it is. Which brings us squarely into section 2, the critical gaps. This is where AI falls short, where the real risks, sometimes profound risks, start to show up. And this first point, it's huge, maybe the single biggest limitation, the illusion of empathy, the fundamental lack of true human understanding. Our source article really hits this hard. It states quite bluntly, the biggest weakness of AI is its inability to experience emotions and true empathy. Goes on. An algorithm, no matter how intelligently designed, cannot mimic the warmth of a human connection, the true understanding conveyed through body language and tone of voice, or the intuition a human therapist uses to grasp an individual's suffering. And then it adds this warning, which is frankly quite chilling, and we really need to pay attention here. This simulated empathy in moments of severe psychological crisis is not only insufficient, but can be dangerous.
Wow, that's a really stark statement. Simulated empathy. It might feel okay in the moment, maybe comforting short term, but is it ultimately just deceptive?
Or worse, could it actually be harmful because you think you're getting real understanding, real connection, when you're absolutely not?
It absolutely raises this fundamental, almost philosophical question about what empathy even is. We have to be really clear about the difference. An algorithm processes language, right? It recognizes keywords, sentiment, maybe patterns, and responds with pre-programmed phrases that sound empathetic. It can learn to say, I understand that must be hard, or it sounds like you're feeling really low. It can mimic caring quite convincingly sometimes, but it doesn't feel anything. It doesn't grasp the depth of suffering, the nuances of your specific life, the emotions behind a pause or a sigh. It's pattern matching, not feeling. True empathy, human empathy, involves so much more. It's about co-regulation, mirroring emotions, that intuitive grasp that goes beyond words. It's a deep connection, human to human. AI just can't replicate that. So why is real empathy irreplaceable, especially when someone's really vulnerable? Because it builds a genuine or reciprocal bond, that feeling of being truly seen, truly understood, that's essential for healing. The harm comes when someone starts attributing real human feelings to the AI, forms a bond, relies on it, and then in a moment of deep need realizes it's not reciprocal, that the understanding isn't real. That can be incredibly isolating, even re-traumatizing.
Yeah, profoundly isolating. And that leads right into what might be the most critical safety issue of all, AI's inability to handle severe mental health crises effectively. This is the absolute crunch point, where all the promises kind of fall apart when faced with real emergencies, where lives could actually be at risk. Our source article is unequivocal here. Studies and reports have shown that many AI chatbots are unable to appropriately recognize and respond to acute crises like suicidal thoughts. And it continues, drawing a really sharp contrast. While a trained human can assess the risk and take necessary intervention measures, AI at best may direct the user to emergency hotlines, which is an insufficient response in critical moments. This is just, it's a critical, potentially life or death safety point. We can't gloss over it. AI just cannot intervene beyond maybe a generic suggestion. That's a massive non-negotiable limit. It draws a very clear line in the sand about where its usefulness ends, especially in dire situations.
And it's absolutely crucial to hammer home why human intervention with training, judgment, genuine connection is indispensable here. Crisis intervention isn't just about recognizing key words. It's incredibly complex. It involves assessing risk based on subtle cues, using de-escalation techniques that require reading someone's emotional state intuitively, building rapport and trust quickly, and crucially, having the ability to take decisive action, like calling emergency services or connecting someone directly to human help. These are all things that are just fundamentally beyond what current AI can reliably do. An AI can't read the nuances in someone's voice, see their body language, understand the complex social context signaling immediate danger. It can't physically intervene or ensure safety. It can't make those complex ethical calls required in the moment. The limits here aren't just about technology being not quite there yet. They're fundamental limits about the irreplaceable nature of human presence, human expertise, and human ethical responsibility when someone's life is on the line.
Moving to another really significant concern, one that touches on our whole digital lives, really. Privacy risks, the potential for data misuse. And the stakes here are incredibly high, given we're talking about sharing our most private thoughts and feelings. The article warns very directly. Mental health apps collect your most private life information, period. And it backs this up, citing scandals like BetterHelp sharing user data, for example, for advertising platforms, as real-world proof that this sensitive data is not always secure and there's a risk of misuse. Just think about that. Our deepest fears, vulnerabilities, things we might not even tell our closest confidants. Imagine that data being shared, analyzed, maybe exploited for profit. It's a genuinely terrifying prospect, and it completely shatters the trust these apps are supposedly built on. You're trusting them with your most intimate struggles, and the idea that this could become, ammo for targeted ads. Or worse. It's deeply alarming. It fundamentally breaks the promise of a safe space.
And if you connect this to the bigger picture, it really throws the whole issue of data privacy in the digital age into sharp relief, especially with health data, which is arguably the most sensitive information anyone has. What are the ethical duties, the legal responsibilities of companies handling this stuff? The source gives us that specific, well-known example with BetterHelp, showing these aren't just hypothetical worries, they're documented realities that have actually happened to users. And data misuse can take many forms, right? Some obvious, like targeted advertising based on your anxieties, which the source mentions. Others may be more insidious data aggregation, creating detailed psychological profiles sold to third parties, potentially impacting insurance, maybe even jobs down the line. Or identity theft. The psychological impact of that kind of breach, that feeling of violation when your innermost thoughts are exposed, it can be devastating, especially if you turn to the app in a vulnerable state. It erodes trust, not just in that one app, but maybe in all digital mental health tools.
Yeah, devastating. And as if privacy risks weren't worrying enough, there's also this problem of algorithmic bias, the hidden risk of harmful recommendations. Our source article explains this really well. AI algorithms operate based on the data they were trained on. If this data reflects existing societal biases towards certain groups of people based on race, gender, or social status regarding mental health, AI can reproduce these biases and provide inappropriate or even harmful recommendations. Now, this is subtle, but it's incredibly dangerous. Technology, which we often think of as objective, could actually end up perpetuating discrimination, maybe even amplifying it, potentially hurting the very people who need help most. Can you unpack that a bit more? How does tech design to help actually end up biased or even harmful in an area like mental health? It seems like such a complex ethical knot tied into the tech itself.
It is. It's a really profound concern, and we have to take it seriously. Biases creep into training data in lots of ways, often unintentionally. Maybe the data used to train the AI mostly comes from one specific group, say educated middle-class folks in the US or Europe. Or maybe the historical data itself reflects old biases in how different groups were diagnosed or treated for mental health issues. The AI learns these patterns, and crucially, it replicates them. So for people from marginalized communities, maybe based on race, gender identities, socioeconomic background, culture, an AI might offer advice that's less relevant, less effective, or even actively harmful, because it just doesn't understand their context, their unique challenges, their experiences with discrimination. For example, maybe a biased algorithm consistently fails to recognize depression in certain ethnic groups because their symptoms present differently, or because of cultural norms around expressing distress. Or it might suggest coping strategies that are culturally tone-deaf, or just plain inaccessible for someone from a different background. This risk of causing harm highlights just how vital it is to have diverse, carefully curated, ethically reviewed training data. We need to ensure these tools are fair, inclusive, and genuinely helpful for everyone, not just a select few. It really shows that an algorithm's objectivity is only as good as the data it learns from. Garbage in, garbage out, as they say, but with potentially serious consequences here.
And the final point in the section on limitations, it's about dependency, creating unhealthy dependency, and maybe fostering unrealistic expectations about relationships. The source article points out something really thought-provoking and, kind of unnerving. AI companions are designed to always be agreeable and supportive. This challenge-free relationship can create unrealistic expectations for human relationships and distance individuals from real social interactions that require effort, compromise, and sometimes disagreement. I think deep down, maybe we all fantasize about that perfect friend, right? Always supportive, always agrees, never challenges you, always positive. But is that actually healthy? especially if it's not real, if it's an algorithm. It sounds, like I said, almost too good to be true. In the context of human growth and just the messy reality of actual relationships, it probably is. If you get used to this perfectly agreeable digital pal, how do you then deal with the complexities, the challenges, the beautiful imperfections of real human connection, which demand resilience and give and take?
This is such a crucial point for long-term growth, for healthy social development. Real human relationships, they inherently involve effort. They involve compromise, navigating disagreements, dealing with different personalities and needs. These things, yeah, they can be uncomfortable, even hard sometimes. But they're absolutely vital for developing emotional intelligence, building resilience, learning empathy, sharpening our social skills. An AI relationship, though, by design, it strips all that away. It's engineered for comfort, for agreement, for smooth sailing. So relying too heavily on that challenge-free interaction, it could potentially stunt emotional growth. It might make people less equipped to handle real-world friction disagreements. And maybe most worryingly, it could create a preference for the easy digital connection over the more meaningful, but sometimes harder, human one. It risks fostering a kind of isolation that's masked by constant digital interaction, a dependency that ultimately undermines rather than supports real human connection and growth. It's really about making sure technology helps us connect better with the real world, with real people, not retreat into a comfortable but ultimately sterile and limiting digital space.
Okay, so we've really dug into both sides now. The shiny promises and the pretty stark realities of AI and mental health. So the big question becomes, how do we navigate this? How do we use these tools smartly, safely, recognizing they exist, recognizing their potential, but without, falling into the traps? Because let's face it, this tech isn't going away. And interestingly, our source actually gives us some really important local context. It highlights how nuanced this all is, how culturally sensitive the whole integration has to be. For example, it mentions that in Iran, research and efforts are underway for the localization and development of AI tools in mental health. They're working on developing Farsi chatbots compatible with the culture and language of Iranian users, calling it a positive and necessary step. And that immediately makes you realize, okay, this isn't just a Western thing. This tech is being adapted, debated, developed everywhere, but always with unique local challenges. But the source is also realistic. It points out big hurdles, like a lack of quality Farsi data for training algorithms, and the absolute necessity of adapting therapeutic interventions to cultural norms. And this part really stood out to me, the key emphasis from Iranian experts. They emphasize the importance of integrating these tools into the country's healthcare system and the supervision of human specialists over their performance. So it's not just about translation, it's about embedding it carefully within existing systems with humans overseeing it.
That's absolutely fascinating, and it's such a critical takeaway for how this technology gets deployed anywhere in the world. It underscores how utterly paramount cultural context is when you're talking about mental health. You can't just, take an AI tool developed in Silicon Valley, translate the words, and expect it to work effectively, safely, or ethically in Tehran or Tokyo or Nairobi. It just doesn't work like that. The complexities are huge. Think about language nuances, idioms, metaphors, how distress is even expressed varies wildly. And beyond language, you got deeply embedded cultural views on stigma, the role of family, community support, even fundamental ideas about the self or well-being. So the need for high-quality, locally relevant data to train these AI, it's non-negotiable if the tool is going to be helpful and not just perpetuate biases. And that emphasis from the Iranian experts on human supervision and integration into existing healthcare systems, that feels like a blueprint for responsible rollout everywhere. It acknowledges, look, the tech has potential, but it has to be woven carefully into the local fabric of care, guided by local experts, local ethical frameworks, to make sure it actually helps more than it harms. This goes way beyond just technical stuff. It's about deep cultural competence, really understanding human experience and context.
Okay, so given all that the promises, the risks, the need for cultural context, the article then helpfully lays out a really practical guide. Actionable advice for smart, safe use. It's almost like a checklist, for anyone thinking about using these AI tools as part of their mental health support. And the first guideline is just fundamental. View it as a tool, not a therapist. The source puts it plainly. Use these applications as a supplement for psychological support or human relationships, not as a replacement for psychotherapy. That distinction feels absolutely crucial, doesn't it? It's an aid, an extra. It can supplement, maybe enhance, but it is definitely not the solution for complex issues. It just sets the right expectations from the start.
Exactly. And the why behind that guideline is critical for your well-being. An AI is software, it's code, it's not sentient. So giving it the label therapist fundamentally misunderstands what it is and what it can do. That leads straight to unrealistic expectations, which can end up being really disappointing, maybe even harmful. Seeing it accurately as a tool helps you maintain proper boundaries, manage your expectations, and avoid that illusion of real empathy we talked about. It's about informed consent, really, knowing what you're actually interacting with and not giving it qualities like consciousness or true understanding that it simply doesn't possess.
Right. Then, next guideline, and this links back to a major risk we discussed. Read the privacy policy carefully. This isn't just like a suggestion, it's vital. The article says, before sharing any information, ensure you know how your data is collected, used, and protected. This feels non-negotiable, right? You have to be your own advocate when it comes to your most private information.
Absolutely. This guideline's all about critically evaluating the tech and safeguarding your sensitive data. Privacy policies, yeah, they're often dense, full of legalese, but they contain critical info. You need to actively look for the specifics. What data are they collecting? Just your chats. Or location too. Device info. How will they use it? Just to improve the app. Or for research. Advertising. Who might they share it with? Third parties. Advertisers. Research partners. And how long do they keep it? Also, pay attention to whether data is truly anonymized, meaning it can't be linked back to you at all, or just de-identified, which might still carry some risk. Understanding these details is so important, especially when you're sharing deeply personal stuff about your mental state. It's about protecting yourself, your autonomy, and avoiding potential harm from data misuse or breaches. The consequences can be serious, both psychologically and practically.
Okay, guideline 3 is about being discerning. Seek scientific backing. The source advises strongly. Choose applications based on credible therapeutic methods like CBT, whose effectiveness has been reviewed in scientific research. Basically, don't just grab any app that looks cool or makes big claims. Look for ones actually grounded in evidence-based approaches. It's not just about feeling good. It's about using something that's actually been shown to work.
Exactly. This point is all about making informed choices and connecting with what we actually know works in mental health care. The market for these apps is exploding, right? It's crowded. So this guideline helps you sort the wheat from the chaff. Helps you differentiate between a tool that's scientifically validated, maybe developed with input from actual therapists, tested for efficacy, versus something that might just be a placebo. Or worse, could give unhelpful or even bad advice. Look for apps that clearly state their therapeutic model, maybe linked to research studies or are endorsed by reputable psychological or medical groups. It ensures the support you're getting is based on solid psychological principles and has a decent chance of being helpful, rather than just relying on marketing hype.
Guideline 4. And honestly, this might be the single most important takeaway from this whole deep dive, the one we absolutely have to emphasize. In crisis, rely on humans. The article is crystal clear. It's a direct instruction. Never rely on AI when facing thoughts of harming yourself or others. Immediately contact a mental health professional, a friend, or emergency hotlines when it really, truly matters. When you are in actual danger, when safety is on the line, reach out to a human immediately. There's just no substitute. No algorithm can replace a person in those critical moments.
This is the absolute non-negotiable safety rule. It directly addresses that fundamental inability of AI to handle acute crises, which we covered earlier. If you connect it to the bigger picture, it's fundamentally about preserving human life, ensuring that when someone is extremely vulnerable, they get the most appropriate, skilled, empathetic, and importantly, responsive care available. And right now, that care can only come from another human being, a trained professional, a trusted person in your life, or emergency services who can provide immediate, tangible help. And AI cannot do a nuanced risk assessment. It can't do real-time de-escalation needing human judgment. It definitely can't physically intervene or guarantee safety. This guideline hammers home. AI can be a tool for support, but it is completely unreliable as a lifeline in a crisis. Relying on it, then, could have truly tragic outcomes.
And finally, guideline number 5. This brings us right back to human connection. Prioritize real social interactions. The source wisely says, don't let the convenience of interacting with a robot distance you from the real world and meaningful human relationships. The AI should ideally enhance, not replace or diminish, our fundamental human need for genuine, complex, sometimes messy, but ultimately vital connection with other people.
Yeah, this guideline is all about protecting and nurturing that essential human connection in our increasingly tech-filled lives. It's a reminder that while AI can offer convenience, maybe a listening ear, even those structured exercises, it just cannot replace the richness, the depth, the unique growth that comes from navigating real human relationships. Those relationships with all their effort, compromise, shared joys, even the necessary disagreements, they are fundamental to our emotional health, our social skills, our sense of belonging. Relying too much on an AI companion, no matter how agreeable it is, risks leading to, well, social atrophy, a weaker sense of connection, ultimately a more isolated life. It's about finding that balance, right? Using digital tools for support, yes, but always making sure they complement rather than subtract from our basic human